Hello.
Hi,
Hi,
Mandar.
Dr. Sandhya. Hi. Hi, good to see you here.
Yeah.
Thanks for joining. I'm just going to give a brief intro and then we'll get rolling. Hi, everyone. I'm Mandar Gadre. I'm a member and certified metabolic health coach from DLife.in, which is India's first and the only award winning low carb platform. DLife was founded in 2014 by Anup Singh, a silver medalist from IIT Roorkee and a recipient of the Icons of India Award. Anup is also the pioneer of the low carb movement in India with his path breaking protocol of 100-gram carbs per day maximum. That made him not only the pioneer in LCHF but also in type 2 diabetes, especially geared towards Indian vegetarians. In 2020, Anup DLife launched the Diploma course, which is now the only course approved by NSDC Partner, Government of India in this segment, and the only course with global biggest 144 credit hours from CPD UK. And Anup, along with Shashi Iyengar, is the co-organizer of this metabolic health conference. Uh, Thanks everyone for joining, and thanks Dr. Sandhya for joining us. We are looking forward to a great session, and I'm my pleasure to introduce Dr. Sandhya Kulkarni here. She's an MD medicine. She's a very inspiring Indian physician who has successfully reversed her own diabetes, reduced her HbA1c, lost some kilos through that, and using a low carb approach. And she's based in Dharwad. She combines her deep medical expertise with a passion for strength training as well as trekking. And I think that way she inspires both her patients as well as peers. She is recognized nationally for her innovation in diabetes care. She was honored by RSSDI for her efforts in spreading awareness and quite practical solutions. And I think she's a good example for patients to follow because she actually lives a good healthy lifestyle, and I'm going to ask her about that as well. So yeah, welcome to the session, Dr. Sandhya.
Thank you. Thank you, Mandar, for the wonderful introduction. Let's go ahead.
Yes, great. So I'm sort of going to take you back to the beginning of your journey of becoming MD medicine, and as well as your own health journey. So sort of please walk us through that time period and what you experienced.
Well, Mandar, being a doctor means staying in the hostels and eating food which is unhealthy, absolutely, as of what I understand now. So, a couple of years ago, I was obese. Though I was exercising, I was not able to lose weight effectively, and I was not happy about it. So, in the process of trying to lose weight, I tried out various diets that were available all through. So I have gone through a diet which had, which wanted me to eat multiple times. Then there was calorie counting, then there was veganism. So nothing was really very effective. The effect was there for a very short time, and somehow I could not tolerate veganism because it used to give me bad headaches and craving. And eventually, I used to eat more than what I would have ever eaten. So all these failed for me. And in my pursuit of finding something really effective for me, before I tell it to my patients, I accidentally came across D Life and I read the reviews, and I thought I had tried everything, so why not this? And when I tried this, one thing is it really fitted in my schedule because I did not have to eat frequently. Eating frequently is not my forte, and in my busy schedule, it's definitely not possible. So things, as I read, I put it into practice and I saw the results for myself. So I am a physician who would definitely like to try things for myself before I put them to my patients, because I need to understand before I open my mouth to my patients, because they would ask me questions and I would have to satisfy them. So this was a real practical, experiment on myself, wherein it was beneficial in all ways. Uh, Along with the diet and good satiety, I could carry on throughout the day. I had lost a lot of kilos. I think about 10 plus kgs I lost. My exercise though remained the same. I have been doing strength training for quite a lot of time now, for many years, and my stamina improved. Everything was really positive, and my HbA1c also dropped down from 7 to 5 point something. So everything was good, and so I thought this is the best way to be metabolically healthy. Not only healthy, be metabolically healthy and keep away from chronic diseases.
Very nice. So I would love to highlight here that Dr. Sandhya is also a D-Life certified metabolic health coach, in addition to being an MD medicine. And I know of her passion personally to continue to learn, and her own example is actually quite inspiring for doctors as well as non-doctors alike. So yeah, thanks for sharing your personal journey, and thanks for highlighting that what all didn't work, right? The 6 small meals a day, and the vegan diet and whatever. So yeah, that's actually great to know, and it's good to see a doctor using that first on herself and then advising patients. Coming to a little more of the science of the overall metabolic health approach, so how did it sort of help you look at the chronic diseases altogether from the lens of metabolic syndrome?
Look, Mandar, I had to learn this. I had to unlearn many things which a doctor learns and which is given to us on platter. Nutrition is hardly given importance in any medical school in India. So, except for I think some final years of MBBS where we learn a little bit of nutritional deficiencies, though India is the diabetes capital of the world, whatever biochemistry is taught in the first year, and when we come to our finals or into post graduation, what happens is we forget the clinico pathological correlation. There's too much to read, and somehow the chain of events that happen are lost somewhere. So I had to unlearn a lot of things to relearn how metabolic syndrome occurs, just by changing your diet or eating too much of carbs or eating the wrong oils. So it was a completely different perspective, and by unlearning so many things, now I have learned many things which changed my entire outlook towards metabolic syndrome. I rather treat the root cause than add pills to my patients now. I have still a very long journey to go because my practice is predominantly in the rural area, and there are lots of myths. There is a lot of resistance to changing in the diet, predominantly area which eats more of carbs all through the day, plus seed oils are very popular. So it's going to be a herculean task, but then one step at a time will definitely help me.
Definitely. I think it's interesting that you had to sort of go through some unlearning, and so let me get that thread which you mentioned towards the end of addressing the myths that your patients may carry in their heads because they have heard a variety of things. But sort of let me start there, right? So, which are the top myths that you hear or you have to clarify, because your advice will sound different to them than some other sources of information?
The first myth is here the day begins and ends with carbs. There's a lot of carbs which are taken in every meal. Then there are lots of fruits which are consumed. Every patient wants to eat fruit, believing that fruits give them vitamins, minerals, and fruits are extremely healthy. If not fruits, then fruit juices. Why not fruit juices? If not fruit juices, why not smoothies? So all these things do definitely affect, and plus they have the WhatsApp university where lots of false information is spread, and people just believe whatever comes on WhatsApp. So many times I have to see their videos and tell them that this is not the truth. So it's basically reducing your carb will help you to get better control of your health. Better control of everything related to your health is the biggest challenge I face. And
Hmm.
it's not only not only the rural population, the semi urban population also has these myths, because a variety of grains are available, and most of them do contain a huge amount of carbs. So if not the basic ones, why not millets? Aren't they good?
Hmm.
Because the millet propaganda has been there, and last year was a year dedicated to millets. So all these myths are definitely there, and I need to sit and clarify them. That's a challenging job for me.
Yeah, and I'm sure you are doing a commendable job there because it's difficult to change somebody's perspective, right? You're trying to challenge something that they have heard for many decades. The other one, I don't know how much you hear in your patient base, but when you tell them typically to pay attention to their protein intake, always they will likely come back with that question of kidney health and all that.
Yes, that's also very common. Basically, the concept of having enough protein itself is not there in my society here. So once I tell them that you need a certain amount of protein per kg body weight, then automatically the second question is, wouldn't it damage my kidneys? There are moms whose kids want to take whey protein, and they say that no, I prevented him because that's going to harm his kidneys eventually. So those misconceptions are also definitely there in my part of the world also, surely.
Right. And the third one, which will always come, is about the fat, right? And the fear of fat, and it's sort of quote unquote its relation with the heart disease, because a lot of these elderly population, especially, will be worried about, hey, I shouldn't become a heart patient tomorrow.
True. It's not only here. I think all over India that misconception is there, that fat will make you fat and fat will clog your blood vessels, and eventually you might have to go for stents, 2, 3, or you might have to go for a bypass. It's not only, see, now we are seeing diabetes not only in the elderly population, we are seeing in very young ones also, because of the crap lifestyle and the crap we eat. So this misconception is there among all the population, that if I eat butter, if I eat ghee, then wouldn't it block my heart? Wouldn't I have early death because of cardiovascular problems or something like that? And it really takes a lot to convince them that there are numerous studies which have proved against it now. But luckily, I am in a zone where we do consume a lot of coconut oil, so the transition is a bit easier for maybe a 10 to 15% people, that they would like to, they find it easier to switch over to VCO, virgin coconut oil.
Got it. So when you educate your patients, right? Because I think as you are explaining, a lot of your work gets automatically focused on educating them, changing their perspective. Is there are there a few pieces of that science that you use, which you have sort of realized that that convinces them little easier? If you can share those with us.
Well, I have to change my pieces and bits according to the crowd I am with. I see the most illiterate and the educated ones, and I see the elite ones also. So,
Hmm.
in my experience, if I talk to the elite crowd about the studies and all, they might like to hear, they might believe, but they are a difficult group of patients. However,
Hmm.
the lesser educated ones, they come to doctor as if the doctor is a god, and then they definitely believe what you tell. Once they are convinced with you that you're doing something good for them, they believe you
Hmm.
blindly. So for me, it's kind of not one thing works. Situational changes do work, from depending on what class the patient definitely comes from. So I can't tell you that one thing has worked. I have to change it from time to time.
Yeah, that's quite interesting, and I think that's why I find it very inspiring when I hear the way you are, working with your patients. It's not just a matter of, as you rightly said, not only the matter of managing the symptom or suppressing the symptom, but actually working at the root cause level. Uh, would you also please tell us, sort of an idea of the demographic that you see in terms of the types of diseases, and as well as the age, what is the distribution?
If you ask me the demographic situation, I have been a diabetologist since 1999. So
Mm-hmm.
till 2024, when I finished this course, I was following ADA, and most of my population, I would say that 70% of my population comes from the villages. They are not very literate, and only 30% of my population is a bit educated, and I would say less than 1% of my population is the one which would understand the medical studies or the review articles or RCTs which are done. So I got to go to the root level to to teach people who graze their cows or sheep, and sit with them, talk in a language that they understand, and tell them the
Mm-hmm.
importance of changing their food. Now, it's easier to change religion than to change the food pattern. So it's a big, big bang, bang, bang here. But over a period of time, people do believe you, people do trust you.
Mm-hmm.
Trust me, I must also tell you that doctors are the ones who will never trust you, would never believe, or would never like to go against the mainstream, because that is what is given on platter to us every year. Year by year we have newer guidelines, and that's what is circulated to us, and we are expected to follow it. So I am the one who is standing against the current, and I still don't mind, going against the current, because eventually I'm doing something good for the patient. Not only health wise, I'm doing good to them economically also. Over a period of time, they would definitely understand, and if they have better numbers, they would definitely like it, and that's how it works. So it's a complete change of setup as compared to yours. I'm in a absolute rural setup.
Absolutely. And I think it's so heartening to know that, all this knowledge is reaching a diverse population. And once that trust factor is established, you are able to get through to them and they are actually following, your advice. So you talked about going sort of against the mainstream or against the grain, so to say. How difficult or easy was it? And what was your experience? Did you experience any pressure from your peers or any comments, or any pushback at all?
Well, Mandar, some things are in like a blessing for me. I have been the only lady physician in Dharwad for the past 25 years. So, what happens is, I do whatever I feel is good, and there's no peer pressure, and there's nobody to ask me, because I do whatever I feel is right for my patients. So the question of any peer pressure was not there, and resistance wise, when I am well equipped with knowledge to face the resistance that they offer, and more than my own physicians community, there are other
Mm.
doctors communities who have readily accepted what I have said. I have been to an ophthalmology conference where I have given a 20-25 minutes, just a small eye opener about this, and post that, the number of queries, the number of questions they had was phenomenal, and it was very evident that they wanted to know more about it, because they had heard about it but they were not knowing. Whereas in physician community, it's definitely, sometimes the ego also comes in between, like, why should we listen to this, why should we listen to her just because she has done a course, kind of thing does come. But then I don't mind,
Mm-hmm.
eventually truth wins.
Yeah, absolutely. I think, yeah, it's so interesting to hear this, that the way you have calmly but also with all the force of that knowledge as well as the science, you have continued your efforts not just to educate your patients, but also continue to talk to your own peers. And I think we need many more like you in India and abroad also, right? Who are doing the right thing. And I think it must be so satisfying to do that, because you're seeing people heal at the root cause level. So that's, I think, very interesting. One question I have is, when we talk about changing food habits, right? many of these people may ask you that for generations we have been sort of eating this food. How come, my parents didn't have this, or I have seen my grandmother or grandfather, be healthy till, a long age. Typically, I mean, do you get that question, first of all? And secondly, if you do it, how do you address it?
Definitely, this question comes quite a number of times. What I tell them is there are a couple of things which are different in every generation. Like for example, very simple, the stress levels in our parents were lesser, and the stress levels in our grandparents were very much lesser. So the stress levels today's generation has too much. So that the stress itself can cause high cortisol level, insulin resistance, and physical activity also is very very less, because most of them do table work or mental work very often. Secondly, I am blessed to have Agri University here, and I did talk to the people, and I have asked them how are the grains different from what we eat now and what we used to eat
Hmm.
earlier. So
Hmm.
after 1960, there has been a green revolution in India, and the food production has, multiple, increased in multiples. So earlier the food was different. The grains which we grew were different. Now most of it is GMO, and GMO has certain criteria, like the shelf life has to be longer, the amount of carb has to be good, the amount of fiber has to be less. So that way, what their parents ate was different, what they are eating is different, and their parents never ate so much of junk food which is deeply fried and with seed oils and baked. You never know. Now they say that they don't use trans fats, but how are you sure that they don't use trans fat? I have my own doubts. Plus, I
Hmm.
also wonder how people can afford to give food at such cheap rates at small outlets, roadside, street side eateries. Then I came to know from one of my patients that the oil which is used in bigger factories is filtered and given to them at a very lesser rate, and they use that, and that's why they can afford. So I do use these examples to tell my patients that these are the differences in your generation versus your parents or grandparents. So now you're eating crap, that is why you have more of diabetes and hypertension as compared to them.
Wow. Yeah, I think that's a hard-hitting answer, and thanks for elaborating that, because many people will come with that question, as you said.
True.
Uh, yeah. So I would also love to know, maybe if you can share with us two or three inspiring and interesting cases from your patients, because you clearly have a very different approach compared to some other physicians that they may have met. So that our listeners also get inspired
Yes,
hearing those
sure,
cases.
sure. I will talk about a couple who comes to me, whose child is a doctor and very junior to me, and they come from
Hmm.
another town to me for control of blood sugars, and they've been coming to me for a couple of years now, and over a
Mhm.
period of time, though they tried their best, the sugars were not very well controlled, and we were like going on increasing the medication and in trying to settle insulin levels, like insulin units of insulin and all that. Whatever they did, it was not satisfactory either to me or to them. That's when I told them, look, we have to change your eating way. Now, most of the population here in Dharwad is vegetarian. So I had to
Mhm.
convince them a South Indian eating paneer every day, a South Indian, including almond flour in the food, was a big challenge for me and for them too. But then slowly we did. I taught them how to, I taught them, some kind of South Indian recipes where they could use paneer. So we began
Mhm.
with, just half paneer and half of whatever they were eating. And eventually we went on increasing the amount of paneer. We went on increasing the amount of almond flour. I told them about, not having too many things to snack in between, no snacking. And over a period of time, their HbA1cs came down so beautifully. Like they are now, they were somewhere around 9, and now they are somewhere around 6, 6.2 within 2, 3 months. So last time they came to me was about a week ago, and they so happy. They said, ma'am, this is a little bit expensive, but my sugar was never so well controlled, and I'm feeling
Mhm.
happy about it, and I'm going to continue it. So tell me what next, how well can I do it? So these two patients, doctor's parents were happy, and I said, go tell the world around you that we have not increased your medicines, but we have changed your food pattern, and that's how you have benefited from it. So these patients were inspiring. Another lady, post pregnancy, she had a huge weight gain and became diabetic. She was 5XL, and she came and said, doctor, I'm so happy. I am now able to buy clothes online because my size was never online available online, and now I use a 3XL size. So these small things do make me happy along with the happiness of my patients. So it's slow, steady, but still it's going on.
Yeah, it's so heartening to hear. Very happy to see their progress as well. You brought an interesting point of the actual monetary expenditure also, because as you said, you work in a setting where there are folks without that much wherewithal. They can't really spend on medication. So for them, it's even more important, right? So how would you sort of urge our listeners to look at it more holistically, not just from a this is the symptom and this is the medication point of view, but actually a long term real calculation of the costs involved? What
See,
would your message be?
See, my message is, whenever you see the cost, please see the cost for at least a year. It's not, diabetes is, according to our standard definition, diabetes is a progressive disorder, and it's going to be there with you for life. And as per the current medical statistics, or going on with the mainstream, we only, what we can do is, or what we do is, we only go on increasing the pills, or we only go on increasing the insulin dosage. And
Hmm.
I'm sorry to say, with the pharma, a doctor never knows the price of a medicine. He would know what is new in the market, but he or she never knows the price of the medicine. So the pharma industry plays games with us, tricks with us, newer insulin, newer drugs, but the prices are never told to us, and we don't remember. So if we calculate the price for a month versus the price of food for a month, i
Hmm.
think
Hmm.
I think though food appears to be expensive, it really is. Though the right food or real food appears to be
Hmm. Hmm.
expensive, it really wouldn't be. And plus,
Hmm.
you also have to see the long term consequences of having diabetes versus a long term consequence of having no diabetes, or
Hmm.
no medication. You also do compare those. A stent would
Hmm.
easily cost you 2 to 3 lakhs for the stent. Forget the hospital stay, and forget the lifelong medications, which are deadly. They cost a lot. They cost a bomb. I see them
Hmm.
every day. So if you compare that versus if you compare a
Hmm.
protein rich food, a real rich food, good food is definitely inexpensive, affordable. Everybody should be affordable to not have problems which can be controlled by food.
True,
So
true. We have to truly. Hmm.
that's how
Yeah, we
I
have to
treat
calculate
my
costs.
patients.
Yeah, I think that perspective is interesting, and it is impactful coming from their own physician who is urging them to calculate the costs correctly. Also, one more question is, let's say a patient comes to you, going by the inspiring examples that you just shared, and very sincerely they change their nutritional pattern, some habits, and over, let's say, 3 months, 6 months, they saw some difference. Do they ask you that for how long now I need to continue to eat like this? Can I go back to my normal pattern?
That's very commonly asked questions by everybody, because people believe that diet is not for life. Diet is for a
Hmm.
very short period of time, and everybody wants to go back to whatever they were eating or whatever they were liking. So well, it's my answer is, you should eat this as long as you want to be healthy and happy and disease free. If you want diseases, you are most welcome to eat them at any time, and you will get not one, you might get all at a time. Because When we explain diabetes, we do tell them that head to toe everything is going to be affected. You just won't know it now, but it is a multi-organ dysfunction. So if you start eating the wrong way, one by one the organs may go, and then we will not be able to get them back. So before you eat, think, you really want to eat it once in a while, a little bit, off track is okay, get back to track immediately, because that's not the way you should head to. You will not do anything good to you if you eat the wrong way. So as long as
Yeah,
you want to eat, as long as you want to be healthy, eat this way.
yeah, I'm sure our listeners are getting your message loud and clear. That it's more of a lifestyle and a long-term approach rather than some quick fix. And especially because we are trying to address the root cause. We are not trying to only suppress the symptoms. I don't even call it managing the symptom. Also, would you briefly throw some light on once they get one of these manifestations of metabolic syndrome, right, whether it is diabetes or they may start with hypertension, but then it's almost like a door which is now open, and then it simply exposes them to further risks. So could you please briefly talk on that, because you must be seeing in your practice that somebody starts with diabetes and then after a few years diseases only get added, as you said.
So all these years I have been just seeing this, that one by one, over a couple of years, patients get worse and they have multiple complications. Well, a complicated patient or a patient who is diabetic with multiple complications, retina, food complications, it may be difficult for them to change the diet completely at one go. And they may not be off medications also, but lesser the
Hmm.
medicines, better it is. So sometimes people have that idea that diabetes runs in families, so the parents have or the grandparents have diabetes and they do have complications. So sometimes it is an advantage when a new patient, newly detected patient, knows what has happened in the family, and we can definitely tell them or catch them young, saying that if you don't want to go
Hmm.
through that cycle, or if you don't want to go through those complications, it's good to eat right food. And I do tell them that no doctor will tell you to change your food this way, no dietitian is going to tell you to change your food this way,
Hmm.
unless they know. Maybe 10 years down the line they might tell you, but I am the first one to tell you, believe me, and this is science backed. It's not that I'm just faking you something. I have a degree and I'm going to tell you only what is beneficial to you. So seeing complications sometimes definitely helps the patient, because they don't want any complications. They don't want to lose eyesight, they don't want to lose a limb or a finger. So they definitely would try to. And the newer generation is slightly better than, they are net savvy, they would read and they would come up with questions. So if a younger one comes, it's easier.
Got it. And continuing on that very last comment of yours, so what would you also say to the younger physicians who who are at the maybe at the beginning of their career, because you went through D-Life course, you also apply now the metabolic health approach. So how would you share your experience with D-Life with them, and how will it help them in their practice early on?
See, D Life has been a game changer for me. It's not only me that has changed, it's my entire family that has changed. I live in a big family, so my other family, the second round of people, also have made changes in their lifestyle. So, lead by example, though, I have done. For the younger physicians, my urge would be, nutrition is a doctor's forte, because you have to tell it along with medicines. It's easier for a doctor because he would be or she would be the one who would see and change the medicines, unlike the nutritionists who are non-doctors, who might tell their patients to go to a doctor and lessen the medicine. So you are always at an advantage. So dare to go against the mainstream. Read, take advantage of D Life, which is there now in India. Otherwise, we would have to pay in lakhs to do this course from abroad. So D-Life is a game changer here in India, very much available. The forum is there. You have lifetime access. You have friends. You have people who are giving you knowledge. There is so much, so many articles, more than any medical journal gives on D-Life. And means the younger physicians should definitely do this course. They can apply it right away, even if they are not diabetologists, even if they are physicians, or even if they are doing any other form branch, they should learn basic about nutrition, which is easily available, and they should benefit. Once you are benefited yourself, then you start believing it and you start propagating it. So that's how it should be. If a doctor knows, he can tell 10 people at a time, and those 10 can also tell another 100, and that way we can actually give a message to the society and start improvement. Because we are the staying in the diabetes capital of the world, and we are the carb capital of the world also. The variety of food which is carb centric here is tremendous. So we only can propagate it, and if it comes from the horse's mouth, sooner or later people believe it.
Great, great. No, I think it's a very hard-hitting thing that you said, and I'm also glad to share with our audience that there are more than I think 47 doctors by now who are part of D-Life, who have either graduated from D-Life diploma or who are currently pursuing it. And we see so many success stories put out by them and by other coaches as well. So it's always heartening to hear, and the ground level impact that you are speaking of, within your own family, in your patients. And what I really like about your example and your story is that you are living that lifestyle. You are very active. You are not just doing strength training, but I know you are an avid trekker. So I want the audience to know that you're very active. So when they see a doctor implementing the real healthy habits, and they are not just preaching, but they are actually walking the talk, I think that is really what is inspiring, and that will inspire a change in them, because it's sometimes easy to just sit and give advice. But I know that you are a different kind of a doctor who is first made that change, shown the benefits, and now giving advice. So on that note, may I request Shashi and Anup to come in, please? Yes, can they be put on spotlight?
Yeah, by the time they do, let's not kill time. Dr. Sandhya, it is a very special moment for us because you are one of us, right? It's part of D-Life team, and five doctors are now, I would say, making a debut on this international platform. So, and I would just like to add one thing. You rightly said, never calculate cost on day-to-day basis. Always go for 1 year, 2 years, or whatever it is. Just to put that into perspective, in 20 years, a typical diabetic spends 15 lakh rupees. And this is not some, magic number pulled out of nowhere. This is based on a survey and published online. So 15 lakh rupees in 20 years is 75,000 per month, per year, which is 6,000 rupees on an average per month. So any low carb diet will always be cheaper than this.
And the cost is only going to increase.
Yes,
Medical cost is
yes.
only going to increase. It will never,
Yes.
regress.
Thank you.
Dr. Sandhya, thank you very much again for appearing and sharing your knowledge here. So there was a time when I used to meet doctors like you. I used to meet MTs, diabetologists, cardiologists, promoting anti-diabetic statins, cardiovascular medicines for.
I know you were working for Abbott.
I was in Abbott for 32 years and Pfizer for. Yeah, in a different division. Yeah.
Okay.
So
I'm
we
not
had.
supposed to say any brand names here.
So Abbott has a couple of other metformins also. So I was promoting the other brand, and primarily in cardiovascular also for quite a long time, including statin, of course. So I was promoting statin for 15 years. So I always realize that whenever we, it's how difficult it is for doctors like you to really change your approach and come towards nutrition and adding nutrition angle to your patients, which will get results. So I'm sure that in your patients you must be looking at not purely diabetes remission, but better control and reduction of medicine, which itself will be a big win for your patients. So thank you very much.
Thank you so much for the opportunity. I appreciate all of you very much and all the best. Let's rise and shine together.
Thank you.